Welcome to the introduction to Invisalign. Now, even though we're focusing on Invisalign, we're mainly focusing on different bites and how these bites could be corrected. And that's what we're going to be covering in this course. Here is the way we categorize the smiles you want to treat, or you will learn to treat, or if you are in the dental field or you go to specialize. Knowing the basics about these different bites will help you realize how we could fix them and get all the top bites that are on top to the one that's on the bottom that's really complete. Now, we're going to be learning about different bites. However, initially, we need to learn what a healthy smile or a, a bite where there are no misplacement of teeth looks like. So we begin with just one of the cases, and we have right over here. This is from Invisalign directly from their software called ClinCheck. And this is a person's smile. Now, the things that we want to look at is that there are no spaces between teeth, either on top or on the bottom. We also see in this bite that the top teeth are sitting over the bottom teeth. So if we look at this angle, we could see the upper teeth are basically over the bottom teeth. In the side view, they're also in the middle. The upper teeth are over the bottom teeth. And if you look at it on the side view, they're also on the other side over. We also see that the top teeth cover only very little of the bottom teeth, about 20, maybe 30%. And you could see in this like a holographic view that the upper teeth are covering very little. We also notice that the sharp teeth, and we'll just look on one side for now, this sharp tooth compared to this sharp tooth, their relationship, and this tooth to this tooth. Now, if we go to numbering these teeth, we will see that this is 6 and 27, that's the two canine teeth, and this is 3 and 30. So we're basically looking at the first molars and the two canine teeth on a person's one side of the mouth. So now if we were to take a look at this, and we were to outline these two top teeth blue and the bottom two teeth red, we would see that the molars, that the upper teeth are half a cusp. This is called a cusp right over here. This area is called one cusp. This is another. We could see that the upper teeth are half a cusp behind. Or the right way is to say that the lower teeth are half a cusp in front. That's the normal way the teeth go. And the same thing applies that even though we see that the bottom tooth is here, we can see that the bottom tooth is half a cusp in front of the upper tooth. That's considered a normal bite, and we'll look at this a little bit more. And we see that the front teeth aren't overjetting too much from the lower teeth. So this is a normal bite. Now that we know what a normal bite looks like, let's go take a quick look at some of the bites that Invisalign may treat or braces could treat. And what do these bites look like and what are their names and how do we classify them? Okay, so we're diving back in. So the first bite is gaps between teeth, and it's fairly simple. There's spaces between the teeth. Either the teeth are super small, and when they're put into the jaw, like over here, maybe the teeth don't have enough space to be next to each other, and so they're equally spaced out. So gaps between teeth. The gaps could be between the front two teeth. The gaps could sit on the sides anywhere. They're simply gap teeth or gaps between teeth or spaces. That's one of the bites that we categorize. The next bite is what we call open bites. The top teeth do not touch the bottom teeth. Just like we learned a moment ago, the top teeth have to sit over the bottom teeth, about 20 or 30% covering of the lower teeth. Here we see that the upper teeth don't cover at all. And there's a space between the top and the bottom. That's what we call the bite is open. So we categorize it an open bite. The next category is the opposite of an open bite, what is called an overbite or a deep bite, where the top teeth cover too much of the bottom teeth. Usually you could see that the top teeth are covering the bottom teeth about, you could say 70%, 60 to 70%. Sometimes they could even cover 80, 90%. So this is called a deep bite. That's the fancy name of categorizing this bite. Sometimes we could say, hey, there's a deep overbite. So that's why we left two names here. Now, if you look at the next one, is what's called a crossbite. In this category, we see some of the upper teeth positioned behind the bottom teeth. And unfortunately, that's not the normal bite because there's interferences when you have to chew or when you're trying to move back and forth. And in this case, we categorize this as a crossbite because the top teeth sit behind the bottom teeth. So they're crossing to the wrong side, or they're crossing behind the bottom teeth. Now, not all the teeth will be crossbite. Not all the teeth are going to be in the wrong position. Some of them will be. It could even be that some in the front are, or maybe the front is all normal and maybe just one side of the mouth has a crossbite or the other side has a crossbite, or it could be a combination of crossbites. Now, if we continue, this is what we call crowded teeth. Here, teeth overlapping each other due to the narrow spaces in the jaw. We could see that over here. Yes, there is a cross bite here. Yes, there's a deep bite here, but we're mainly focusing that the bottom teeth, they're positioned in the wrong place, and the top teeth are positioned in the wrong place, and they're overlapping each other. So that's called crowding because the teeth have no space. They're bunched together. They're narrowed together. They overlap each other. Next, we go to what's called an underbite. Now, the underbite is just as it sounds. Here we have the upper teeth behind the lower teeth, or we could say that the lower teeth protrude forward. So an underbite, that means the lower teeth, the lower jaw is longer than the upper jaw, so the lower teeth go over the upper teeth, and that's considered an underbite. And that's not the right way for teeth to be positioned. It causes a whole bunch of problems. Now we're going to go over a little example of multiple problems. Here you could see an open bite on one side. Same smile has a spacing between teeth or gaps between teeth. Same bite has crowding on the bottom where teeth are overlapping each other. And same bite has a cross bite where the top tooth is behind the lower tooth. So here's the categorization of the smiles we want to treat: gaps between teeth, open bite, crowding, deep bite, cross bite, and then even though we call this an open bite, this is an example of multiple problems with the gaps between teeth, the cross bite, the crowding of teeth, the spacing between teeth, the open bite, and all of these will be moving towards this one. So let's go take a quick look how these smiles transform to a beautiful and aesthetic smile. On the Invisalign website, under treatable cases, you could find these two basic quick video explanations on how to treat teeth. So we're going to start with generally crowded teeth, and we could see that as the teeth have gaps, open bite, cross bite, no spaces, and they're crowded, slowly the teeth could be shifted into an aesthetic, beautiful smile. Now let's go take a quick look at how we could do this with gaps between teeth. Here are the gaps between teeth, and we could basically take those gaps and we could have them be brought together in a nice and aesthetic smile. And if we were to take an open bite, and we could see that the open bite could be closed and the teeth could be shifted into an aesthetic smile. And we have a overbite or a deep bite, and we could raise teeth back up into the right position so that they're in the right place. And then we have an underbite right here with an underbite, we could shift the lower teeth behind the uppers and bring the uppers over and create a nice and beautiful aesthetic smile. And if we have crowded teeth where they're not in the right position and a whole array of problems, those crowded teeth could be shifted into a beautiful smile. There's even a way, as a child is growing, to have baby teeth mixed with adult teeth. As the teeth come in, braces or Invisalign could be done. And Invisalign just is an aesthetic way to do it, where we could easily transform teeth into a much better position, where we have a combination of baby teeth and adult teeth. You could always visit the Invisalign website and see how all of these beautiful smiles could be transformed from where they are to what they could possibly become. Now we categorize the smiles that you would want to treat into how they could be transferred into a nice, beautiful aesthetic smile. Let's take our training to one more step deeper. Now, in this case, this is very important. We look at the right and left side relationships of the canine and the molar relationship. And depending on where they are, we classify them into three categories. Class 1 occlusion is what we call a standard bite, where the upper teeth sit over the bottom teeth. And this is where we have the molars that are bottom molars, first molar is half a cusp forward, and the canine is half a cusp forward. However, let's jump into class 3 first. Class 3 is where the lower jaw goes forward, and unfortunately we have what's called an underbite, which we just saw. And then class 2 is where the opposite happens. The upper jaw shifts over forward, and then we have the front two teeth sticking out. Now sometimes these upper jaws and the lower jaws dictate where the teeth will be positioned. So class 1 is normal, class 2 is where the upper jaw shifts forward, and class 3 is the opposite, where the lower jaw shifts forward. Now if we were to actually zoom in inside the mouth, here's a beautiful by class category of a left and right side relationships. Now when we say A-P, what we mean is anterior to posterior relationship, or how do the front teeth relate to the back teeth, or what's the position. And we see in an ideal situation that the class 1 half a cusp of the molar bottom tooth is forward of the upper, and half a cusp of the sharp tooth canine is forward. On both sides it's the same. Here you see the half a cusp is forward, the bottom from the top, and half a cusp here is forward from the canines. Now everyone always asks, why in the world would the lower teeth be in front, yet the upper teeth be over the lowers? And the simple explanation is the front two teeth of the uppers are really wide, and all four bottom teeth on the bottom are really small. So the small bottom teeth, because they're they're brought together, squished together, they allow the upper teeth to go over, even though in the relationship, the lower teeth, anterior posteriorly, the cusps are forward. Basically, the fact that the cusps are forward, the front four teeth compensate for that because they're smaller in size and they get pushed backwards. And then in class 2, we see the opposite. If we look at the outlines, we see that the front two teeth are shifted forward. Remember, the upper jaw is shifted forward. And here we see that the opposite relationship happens because it's the wrong relationship. We have half a cusp of the upper molar over the bottom tooth, bottom molar, and we see half a cusp over the bottom canine. And this is what's classically referred to as a class 2 malocclusion. And then when we look at the other side, we see the same thing. Half a cusp of the sharp tooth is over the bottom, and half a cusp of the upper tooth is over the bottom. Now, if we go to class 3, a whole different approach. Remember, the lower jaw is shifted forward, And in this case, we see the opposite. We basically have class 1 situation, but elongated. Here you could see more than just a half a cuspis of forward. It might be 1.5 cusps forward of the first molar. And we can see the canine way up front of the upper canine. And the same thing on the other side. We see the molars way in front, a cusp and a half forward, and then the entire canine could be shifted forward. That's because we have an underbite and all the entire lower teeth shift forward. Now, if we could take a quick look at how these teeth look in real life, let's jump into the next example. Here's a normal bite, class 1. We could see that the upper teeth are over the bottom teeth. The lower molar is half a cusp forward. The canine is half a cusp forward. Here we could see the teeth outlined again. The lower molar is half a cusp. This is right here in front, and the canine you could see is in front, while all the upper teeth are over the bottom teeth. That's a class 1 occlusion. And as discussed before, you could see that the front 2 teeth are bigger than the 4 bottom teeth. And if we just look at the lowers, we could see that all these 4 teeth are coming together in a good bite, and they compensate for the bottoms being forward. So when the upper teeth go over the bottom teeth, as in this case, we could see that they're going over the bottoms without any interferences. Now in a class 3 occlusion, we would see the opposite. We see that the lower teeth are protruded forward, and they're in the wrong position. And here we could see that the sharp tooth, the canine, is way in front. And we could see that same thing on the other side. In a class 3, we could see that the lower canines are way in front of the uppers. And yes, the molar is slightly forward, but in this case, not too much. Remember, there could always be variations of the standard malocclusion. So if we take a quick look at this bite, if we were to shift everything back into the right position, we'd create a beautiful anterior posterior front back relationship, and we would get back to our class 1 occlusion. So this is just an example of a before and after. Class 3 back to class 1. Now we're jumping into a class 2 occlusion. Here we could see that the upper jaw is forward, but the front teeth are pushed back. So in a class 2, if the front teeth are pushed back, that's called class 1, and if the teeth are pushed forward, it's called class 2. Small correction, class 2 division 1 is where the front 2 teeth are protruded forward, or more than just the front 2 teeth, and class 2 division 2 is when the front 2 teeth are positioned backwards. In this case, the one we're looking at is class 2 division 2 occlusion. So going back to class 2 division 2, we see the upper jaw is forward, but the teeth are pushed back, and this is how we would shift the teeth into the right position to create a more ideal class 1. So let's take a quick look at how that looks in the front. So we started here, and we gradually shift the teeth up. And then if we look from the other side on the area over here, the teeth are basically being moved forward. The lower teeth are brought down, and then we shift everything back to create a more ideal class 1. Don't worry about these missing teeth. This patient had infections in them, but we're basically correcting the wrong bite by shifting teeth into the right position. And remember, class 1 occlusion is what we always want to bring our teeth to. So just remember, always categorize the smile you want to treat or the smile you're studying to know what your starting point is, and now you have a general idea what your finishing destination is, or your final destination is to have a beautiful smile where the upper teeth sit over the lower teeth. The upper teeth are covering only 20 or 30% of the lower teeth, and it's very simple. You would just mark the top of the tooth of the lower to the bottom, and then see how much of the top portion is covered of the bottom teeth by the top teeth. And you want to know, make sure that there are overlaps where the upper teeth are covering the lowers, the teeth are side by side, they're lined up like soldiers, and there's no gaps between the teeth, there's no crowding, and just review this lecture over a couple of times and then supplement your information by looking at our other courses. We do have an in-depth breakdown on an aesthetic approach to Invisalign and categorizing things, and we go into some more details in certain things, but this would be your main core training.